And what I wanted to start was, you sent me your story and I read it and it just connected with me. It resonated with me. And not because I'd heard it before, because it's your story. It's unique, it's different. You went through so much and it's complicated and it's really complex. And what you went through is really harrowing. Nonetheless, I saw so many other patients' patterns in that of why is this happening to me? My life was so normal, and then this suddenly came and totally flipped my life upside down. And you navigate all that for years and years, and now you're sitting here in a much healthier state. So tell us, take us back to maybe what was it, 2011, and what that was like before and after in your story that led you to learn so much about medicine, health, and overcoming a truly debilitating disease.
Okay. Well, I went into this whole situation with a background in nursing and in massage therapy. I was a massage therapist in my uh, 20s. I had a private practice. I did well with that. I went back to school, became a nurse, and I was worked in surgical intensive care. I went to Case Western Reserve, which is one of the best nursing programs in the world. And still, yet, with all that background, what happened to me happened to me. And, um, when I first got sick, I thought, oh, I just have a pulled muscle in my neck and I've got this, I can figure this out, no problem. And it didn't take long before I knew I was in really big trouble. Um, Within weeks, I couldn't talk or chew or use my arms. Um, I couldn't turn my head. I couldn't nod my head. I eventually I was using my arms like this. I mean, I couldn't move any of this. I had just debilitating pain. My son was 5 years old. He was in preschool. And, we had just a charmed life. We had a country place and I was going to grow most of our food and I knew what it took to be healthy. But what I didn't know was that I had undergone some procedures that had left me very vulnerable. And I had a lot of toxins in my system, a lot of poison, which left me to where I got very, very sick. So I I went to a bunch of doctors. Uh, I had swallow tests and CAT scans and all of the usual things. And I tried all of the usual things that would get rid of, we thought maybe there was a muscle tear in here because nothing else really made sense. And I, nothing was working. And
How many
no one
doctors did
knew.
you go to during this course, and how many years we talk about? Because you tell the story. I read it. It's sort of became almost like that in a few weeks. You went from what you seemed like quite healthy to basically disabled, not able to really speak. Almost, you said, unable to use your arms so much, unable to swallow. I mean, these are functions you need to kind of live almost, or else you do become sort of bedridden and you lose a lot of what your freedom was, I would say.
Oh yeah, definitely. I mean, even with the chewing, we got concerned at one point. I was able to get that under control by not doing anything. I basically laid in a bed, but
Hmm.
before I figured that out, and a couple times there was a scare where we thought I might have to get a feeding tube because I couldn't chew, and I was on a liquid diet, and I did eat a very boring, soft diet for about 8 years, which was nowhere near nutritious enough either. Um, but I think I kind of got off track. What was your question?
Yeah, I want to actually find out and set the stage a little bit as to, so this happened within 2 weeks. Were there any signs before that of anything
Oh,
going on?
yes. Okay. I knew I was missing something. I started talking and I'm like, I knew he said something else. Yeah, I did have lots of chronic health issues.
Okay.
And back in my childhood, I had a head full of mercury fillings. And I did have the foresight to have all of those removed in my 20s. That was before they had what they now call SMART protocol, which is the proper way to have mercury fillings removed so that you are not repoisoned with mercury while they're taking them out. So they
Right.
protect your airway, they protect you from swallowing it. And that was not done completely for me. It was done the best at the time. Like they used a rubber dam in my mouth, but they did not do anything to capture all the mercury in the air.
Mm-hmm.
So I was exposed to mercury, and I had been exposed to it for years before I had them removed. So we knew I had heavy metal issues, and I had been tested for that prior to getting sick. And I had had a course of EDTA, which is an oral chelation agent to remove that. And then I had kind of gotten a little better. And I didn't have any serious health problems. I had a problem with my knee. I had sinus trouble.
Little things here
But
and there, right? It kind of
right, I
pops
had
up, I
digestive
hear.
problems. I had a lot of weird health problems. Like I would have bladder infections that would kind of take longer. Every time I needed an antibiotic, it took longer. I would need to be on a course of antibiotics for 13 days, where most people would be on it for like 10. Wouldn't quite go away. I'd have to call the doctor. We'd have to get some more. That was very common. Um,
Did the
I had a weird,
doctors tell you that that was normal, or did they start to even inquire then of, hey, maybe we should look at something else because it's taking a little longer?
no,
No?
they just call me a slow healer.
Right.
And they don't really, they're really not trained to investigate for root causes and to look for these kind of things. And it's really not their fault. I mean, they go to school and that's the way they're taught. And then a lot of the follow-up education they have is presented by pharmacological companies and such. So, and of course, the insurance companies and all that want them to do things a certain way that falls into the way that everybody makes money along that protocol. So, they're doing the best they can. As a matter of fact, my doctor, my GP, was a neighbor and a friend, and he went out of his way to try to help me. He was very open-minded about, trying things like that were alternative.
Right.
But first we looked at the standard things. I even tried, a course of steroids and things. Of course, I got much worse. That was the first hint that I had an infectious process, but I missed that clue for a little while. And we just couldn't figure out, why didn't the steroids help? Well, it just must have been too much inflammation or whatever. And so as the years went by, I adapted to the situation I was in and how to cope, and I ate a certain way, and I stayed in bed, and we had a little refrigerator and a microwave in my bedroom. I mean, I really didn't go anywhere. I went, except for the doctor, and I went there quite a bit, but it got to be where it was a real production to go to the doctor, because to do that, I had to call ahead of time. They had to have a room for me where I could lie down. I would wait in the car and then go in. And some medical facilities are so large that I couldn't get around because I had trouble sitting up in a wheelchair. And they have no way, even at the best hospitals in the world, of getting you around on a stretcher. Believe it or not, I was told, oh, you'll have to walk there or go in a wheelchair. And so that would create problems for me. So I tried to go places where I could be right outside and get into the doctor's office, which didn't make a difference after a while. I mean, no one was finding anything.
Yeah, what
So
kind of
I started looking for
diagnoses were
results.
you given? Because most of the time, a doctor in a conventional realm needs a diagnosis to treat. Without it, you're a little bit, you don't know where to go, and you're probably being
Uh-huh.
sent around. So, did you get any real diagnoses, or was it all just kind of exploratory?
I had one person who gave me a real attempt at one specialist who said maybe that it was carotiditis. The
Mm,
carotid artery was inflamed. He had seen people have really such severe pain there. And the pain would get so intense that I would kind of feel the pulse there, you know.
Mm.
So I gave him credit for trying to come up with something that did get me thinking about, you know, my antioxidant status and um, you know, anti-inflammatory herbs. And I had been into herbs and natural healing for years. Again, I started out as a massage therapist, and I had had some weird health problems like with my bladder and stuff when I was pretty young. And so I would get good results with homeopathy and stuff like that for these symptoms that traditional medicine wasn't helping me with.